Hello, I am here with Ros Jones, retired paediatrician, and the premiere of Aseem Malhotra's movie is about to begin. Good to have you here. Tell us whether you're looking forward to this and what you're looking forward to.
Well, of course I'm looking forward to it, Suneel. I don't know. It's a mysterious title, and we don't know how much it's going to be about COVID vaccines or about the pharmaceutical industry in general. Could it be statins? Could it be just capture? I have no idea what this film is going to entail at all.
Right.
So I'm really looking forward to it.
Yeah, Dr. Aseem Malhotra has done a lot of work with statins as well.
Yeah.
My understanding is a lot of this will be focused on the pharmaceutical paradigm, especially over the last few years. What are you looking to see within the movie? What would excite you the most?
Well, I think for me as a paediatrician, it's been a wake-up call with COVID, just the amount of pharmaceutical capture of the regulators. We've been writing endlessly to the regulators, and we get nowhere because they can't just use their own imagination. I mean, the College of Paediatrics now just says they're not interested in my questions about mRNA new vaccines because they follow the JCVI, and then the JCVI, they follow the money, I think.
Very true. Great point there. Okay. Very true. Great point. Now, do you feel that we're obviously working, or you worked on this side of the pond, I'm in the United States. Do you feel that slowly the members of our profession are waking up more to this, or do you feel like there is much more work to do?
I think there's still a lot of work to do. I think people are waking up, but on the other hand, certainly here, the GMC are constantly charging people with it's not really medical malpractice at all. It's mostly about speaking out and thinking that things they say might harm people's trust in the medical profession. Whereas from where I stand, I find people just coming up so full of gratitude to the people who are speaking out. So I don't think anybody here tonight will be harming the medical profession. It's the medical profession itself that's causing their own harm.
Yeah, very good point. And do you think that the whole situation, I mean, I observe everything from the United States, and for me, everything has got a lot worse with pharmaceutical influence, especially over the last 10 years. Do you feel like the United Kingdom has followed the same pattern? And are there any concrete steps you feel could be implemented, perhaps in the UK more than the USA, that would see a change in this paradigm?
I think we probably have followed the States to a certain extent. I think one obvious change I would make is to remove indemnity from vaccine manufacturers. That would seem such a simple thing to do. And then if they were responsible for their own side effects and adverse effects, then it would make them think much more seriously about doing the trials properly, making them long enough, having proper separation between the treated group and the control group, in a way that with these vaccines, the way they were rushed out, and most people in the control group got offered the vaccine within 2 months. Well, to my mind, that's no way to conduct a trial. So I think if they hadn't had indemnity, they might have done the trials properly.
That is a fantastic point. One has to ask themselves always, if a product is so good, why would a company be so keen to eliminate any blame for anything that goes wrong? I mean, it seems like such a basic thing that we've forgotten about, and more people are not asking this question.
Well, it's notable that AstraZeneca CEO quite early on said, if the government want us to roll this out quickly, I have to have indemnity because I don't know whether there'll be major side effects 5 years down the line. And he said that, it's in print. And here we are with AstraZeneca having been withdrawn with major side effects, not even 5 years down the line, but 2 years, 1 year, 6 months, but they had the cover, and they wouldn't have rolled it out if they hadn't had the cover. They said that.
Definitely, and there's so many issues there with the vaccine situation in particular. How about any other medications or any other parts of what the pharmaceutical industry is doing with chronic disease management, say? And you're obviously in a unique position as a pediatrician. We're seeing so many more children getting sick. Is there anything else you feel we could be doing to rein in the influence of the pharmaceutical industry with kids?
Well, we obviously need to be doing much more in terms of lifestyle, but that, of course, doesn't have a pharmaceutical backer. So, I mean, we're, for example, seeing type 2 diabetes now high on the list is Wegovy, which is this new weight loss drug with all its side effects. And, nobody is saying, hang on, if you actually altered your lifestyle, you could get rid of your type 2 diabetes. I mean, I feel so sad for having lost Michael Mosely, because he was a fantastic advocate for lifestyle changes with his fantastic Just One More Thing, or Just One Thing, wasn't it? I used to hear him in the car radio just for a minute. And every time I stand on one leg to brush my teeth, I think about Michael as I wobble about on one foot. But all those simple things, they cost nothing, but there's no backing.
Thank you very much. Great conversation. We are very much looking forward to the movie. Turns out we're from the same town in the UK as well. Okay, absolutely. Yeah, let's do that. Okay.